Now, let's study juxtaglomerular apparatus or juxtaglomerular complex. Juxtaglomerular apparatus is located directly adjacent to the afferent and afferent arterioles at the vascular pole of the renal corpuscle. It is composed of juxtaglomerular cells, microdenser cells, and extraglomerular mesangial cells. Juxtaglomerular apparatus functions as a tubular glomerular feedback system. Juxtaglomerular cells are cuboidal in shape, derived from smooth muscle cells in the wall of afferent arterioles. These cells have a prominent nucleus, and the cytoplasm contains granules of the enzyme renin. Renin acts on angiotensinogen to produce an inactive dichlopeptide, angiotensin 1. As a result of the action of a converting enzyme present in high concentration in long endothelial cells, angiotensin 1 becomes active angiotensin 2. Angiotensin 2 causes the release of aldosterone from the adrenal cortex. Aldosterone increases blood volume and subsequently blood pressure by stimulating the reabsorption of sodium ions and therefore water from the DCT and CD. Angiotensin 2 is also a potent vasoconstrictor, elevating blood pressure. In this picture, the arrowhead shows one renal corpuscle. The arrow indicates juxtaglomerular cells. Microdenser. Microdenser is a specific region of distal convoluted tubule, situated near the afferent glomerular arteriole. Cells become columnar and their nuclei are closely packed together, being sensitive to the ionic content and water volume of the tubular fluid, producing molecular signals that promote the liberation of enzyme renin in the circulation and promote the reabsorption. Look at this picture. This is a renal corpuscle. The black arrow head shows the arteriole. The arrow shows microdenser. The cells are columnar and their nuclei are closely packed together. Extraglomerular mesangial cells. They are small groups of cells lying between the microdenser and the Bowman's capsule at the point of entry of the afferent arteriole. They act as a single sender between juxtaglomerular cells and microdenser. Renal interstitium. Two types of cells we should pay attention. Interstitial cell. They are columnar cells, vertical to the renal tubules. The arrow shows they secrete prostaglandin, which has the function of vasodilation to decrease the blood pressure. Endothelial cells of the blood vessels can secrete erythropoietin, which promotes erythropoiesis in bone marrow. In the late stage of nephrosis, the production of erythropoietin is reduced. Pernicious anemia is usually caused. Let's look at the renal blood circulation. The kidney receives blood from the renal artery, which branches to form interlobar arteries. At the level of the corticomedullary junction, the interlobar artery forms the arcuate arteries. interlobar arteries branch off at right angles from the arcuate arteries. From the interlobular arteries arise the afferent arterioles. The afferent arterioles branches to form peritubular capillary network. Then they empty into the interlobular veins, arcuate veins, interlobar veins, and renal veins. Now let's look at the clinical case. First question. The kidney belongs to your urinary system. Second question. Chronic glomerulonephritis is a kind of common disease in clinic. Its typical clinical symptoms are hematuria, proteinuria, edema, hypertension, and can be accompanied by a certain degree of renal dysfunction. Once the disease progresses to uremia, renal replacement therapy such as hemodialysis or peritoneal dialysis is needed. Okay, that's all. Thank you.